oapl post-op knee immobiliser is used in situations that require lower limb immobilisation. For example, patella fractures, medial ligament injuries, or following any surgery that requires the knee to be immobilised. Providing increased patient comfort and control, the post-op knee immobiliser features touch tape closures, easy access pre-contoured aluminium T-section stays, secure pockets for stays with touch tape closure, and is available in a range of sizes. Fitting the post-op knee immobiliser should be performed by a qualified health professional. Measure the length of the limb, allowing adequate clearance from ankle and groin. Then measure the largest calf and thigh circumferences. Using the size chart, select the appropriate brace. Check and contour as required the medial and lateral stays. Posterior stays have been pre-contoured, so no shaping is necessary. For the universal knee immobiliser, reattach the lateral panels to accommodate the circumferential measurements. You can then fasten the straps, ensuring the patella opening is over the patella. Ensure all straps are firm so there's no slippage and the leg is adequately supported. Finally, check for any potential pressure areas. For more information and care instructions for the post-op knee immobiliser range and our entire product range, visit the oapl website or contact customer service to discuss your needs with a member of our clinical team.